Okay, so for this assignment, I will be doing pregnant and parenting teens. And although parenting applies to both males and females, I will be focusing on females solely because the females are the ones who carry the baby, deliver the baby, and have the physical effects of pregnancy and postpartum. And then the baby often then returns home from the hospital with the mom and resides with her. So, although pregnancy and parenting can affect both male and female, it's more likely that it's going to affect a female more than a male. So for this PowerPoint, I will be going over the definition, risk and protective factors, identified barriers, effects, the role of school social workers, the role of teachers and staff, helpful resources, and then I'll also link my resources at the end. So teenage pregnancy or adolescent pregnancy is defined as pregnancy under the age of 20 years old. Teen parenting increases the risk that the teen will not complete their high school education, and this is due to the lack of support and resources from their school districts. Risk factors include race and ethnicity, living in poverty, residing in a single parent home, low self esteem, early sexual activity, having a mother who has limited educational achievement, having a mother who has had a child prior to the age of 20, exposure and or use of alcohol and drugs. Some protective factors are open and honest communication between parent and child, ensuring the teen understands accurate information about birth control and safe sex, parental support and healthy family dynamics, teens' intent to abstain from sex or limit their partners, teens' knowledge about sexual health, teens' knowledge about pregnancy, and promoting abstinence. I got these sources from youth.gov. So, some of the identified barriers, and I'm looking here at reasons why parenting teens usually drop out of school. So, some of the reasons that they drop out of school are because students receive inadequate supports to remain in school during pregnancy. While the student is out for birthing, bonding, and recovery, there's little to no contact from teachers and her staff. When the teen returns to school, she finds herself unable to make up her work. Schools and school districts lack support and collaboration among teachers, counselors, and social workers to ensure that parenting students understand their rights and are supported. Pregnant and parenting students are made to feel as though they have no choice but to attend accelerated schools, alternative programs, and parenting students often drop out of school because they are unable to make up work, struggle with childcare, and don't have access to on site childcare programs. And for this, I got my sources from the Education Law Center, PA. Some of the effects on teenage parenting and pregnancy um, are the teens themselves. Most of them do not complete their high school education and drop out. 30% of teen mothers who drop out actually obtain their GED. Teen fathers have a 25 to 30% lower probability of graduating from high school, and 10% of teen mothers complete a 2 to 4 year college program, and being a teen parent increases the likelihood of living in poverty. This was also obtained from the Education Law Center, PA. Children born to teenage mothers are at a higher risk for low birth weight and infant mortality, have lower levels of emotional support and cognitive stimulation, lag behind in early childhood and school readiness, are more likely to have behavioral and chronic medical problems, have higher rates of foster care placement, are more likely to be incarcerated at some time during adolescence, have lower school achievement and drop out of high school, give birth themselves as a teen, and are more likely to face unemployment, be poor, and on welfare. Some of the roles of the school social workers, we can support the student by informing her of the legal rights in which she is entitled to, consistently connecting with the student throughout her pregnancy, during her medical leave, and when she returns to promote success, mapping a plan for both before and after the baby arrives in order to assist the student with completing her assignments, educating teachers and staff how to best support the student and encourage success, and assist the student with resources for childcare and parenting courses, information, and support, advocating for the student, and connecting the student with peer support. Some things that teachers and staff can do is to support the student by touching base with her throughout her pregnancy, during her medical leave, and when she returns to make accommodations in order to promote success. Remain open, non-judgmental, and accommodating and flexible, being aware of what legal rights the student is entitled to, and by providing extra support and tutoring. Here are some of the helpful resources that I found, just some CDC, there are different resources listed there. And then here in Columbus we have a few different options, and I really like the Nationwide Children's link there because it gives you a bunch of different resources for teen and pregnant resources. And those are my resource links that I used. Thank you.